We're checking in with infectious disease specialist Dr. Zain Chagla with the latest developments on COVID-19. Thanks for joining us today.
Good morning.
You tweeted out something very interesting yesterday, and it sparked a lot of discussion here in the newsroom as well. You talked about, okay, here in Canada, Health Canada has approved COVID-19 vaccines for children as young now as 12. And yet you look on the other side of the world in India, you look at the devastation there. And you've got mixed feelings on should our children be getting vaccinated when our case rate is so low with children. And yet there, like, should we be sending vaccines there?
Yeah, I mean, there's a lot of work being done globally to try to take off the patents for vaccines to make them eligible for local production. And I think that's reasonable, but knowing these vaccines, especially Pfizer and Moderna, aren't easy to manufacture. It's probably going to be 6 months to a year before you can set up local production. At some point, we have to start saying, where do we draw the line in the sand to say we've protected enough of our society, we can get back to normal, we can be interactive. We've seen in places like Israel, vaccination of the adults has had profound effects on the children. At some point, are we going to be vaccinating very low-risk individuals for the sake of, making our lives even more safe as compared to the adults and even the young adults in other countries that are being exposed to this carnage? Now, we're a connected world too. The pandemic raging in India is not going to just be benign to Canada. We're going to have issues with our own supply chain with generic medications, which are largely manufactured in India, where, again, we're going to suffer from that too. And I think from a humanitarian standpoint, and from a variant standpoint, look, we're looking for herd immunity. We want our population vaccinated. The one thing that could make that unfoil is the emergence of a variant that escapes vaccination. Well, it's going to
Yeah.
happen in a place like India. It's not going to happen here in Canada. And so if we don't take care of that, our strategy may completely backfire at the end.
Now, are you aware of, is there one particular variant in India that's causing most of the devastation there?
Yeah, I mean the D1617 and the related D1618 are the ones there. The D1617 is that horribly named double mutant, which seems to be spreading. B117, the UK variant, is also spreading in India too, but I think much of it is represented by the original strain that was described in India. Whether or not this is more of an issue with virulence, like it's causing more people to get sick, or it's just more transmissible in a population that is incredibly vulnerable, is still unclear. The good news is early data that seems to be coming out is suggesting vaccines work actually quite well against this variant. But again, it's a vaccine number game, right? If you only have 11, 12, 20 million people vaccinated, it's not going to have effects in a population over 1 billion.
Have we seen that double mutant variant here in Canada?
Yeah, so there's been cases described. The vast majority have been related to travel, and so as part of the screening program amongst returned travelers to Canada, they picked up a significant amount of cases. It's what triggered the airline shutdown last week. There have been a couple of cases, I believe, described in non-travelers, although the epidemiology is unclear. And certainly in places like the United Kingdom, they've seen community cases related to non-travel, which again is concerning that it is starting to circulate on the ground.
I want to get back to vaccines right now because we're hearing this morning that both Pfizer and Moderna are looking now long range at working on boosters and looking at vaccines specifically for different variants, because Moderna is saying especially that the virus is going to keep evolving because it wants to survive, right?
Yeah, it wants to survive. And again, going back to that original discussion, it's the viral pool. So as long as we don't vaccinate places in the world where the virus is circulating, we're going to see the development of variants in those areas of the world, particularly amongst some of those people that are immune compromised. So Moderna has released some data around their booster shot, at least showing that the immune response is actually quite good, particularly against some of the immune escape variants. The nice thing as well is that these boosters will likely boost the native response, so kind of also add in addition to what you have, plus give you some extra protection against the variants. But again, the UK is starting to talk about rolling out some of these boosters in the late fall, early winter. it really has to be put on the table with the discussion of people getting a third vaccine as compared to people that don't even have access to a vaccine for the next year. And again, that's
Right.
part that still needs to be bridged.
Right. Right. Well, thanks for breaking that down for us. It's so great that we have your expertise every week, and we really, really appreciate it here on Morning Live. Dr. Zain Chagla, infectious disease expert.
Take care.